gain, those are just a few of the symptoms of polycystic ovarian syndrome, better known as PCOS, that affects between 1 in 10 and 1 in 20 women during their childbearing years.
And so Dr. Alyse Kelly-Jones, an OBGYN, is here to walk us through exactly what this syndrome is. So please do give us the details, because we're kind of hearing different things when we read online.
Right. So anytime in medicine when we use the word syndrome, it means we don't completely understand it. And this particular disorder has been around since 1935. It's had several names, and the name is actually a misnomer. It really has to do with what the ovaries look like on ultrasound, but really what this disorder has to do with is your hormones and what your hormones are doing in your body in relationship to not only the food you eat, but maybe some of the chemicals that we're exposed to.
So how does this play out in a person? How do you know if this could be something you need to be looked at for? What are symptoms here and signs that you need to go see a doctor?
So typical symptoms are irregular periods or complete lack of period, infertility, so I'm trying to get pregnant but I can't, it's just not working, hair where we don't want it, so hair along the lip, hair along the chin, hair in other places that we don't really want it. Acne, oily skin are all signs of PCOS. And then there's some blood tests that we can do to determine if a woman is at risk or is more trending towards the syndrome.
Now, how early can women be, I guess, susceptible to this? Teenage years or
Absolutely.
childbearing?
I diagnose teenagers with this disorder, and I diagnose women in their late 30s, early 40s with this disorder. Weight gain is another huge thing. Women will not be able to lose weight despite trying all the diet and exercise things that we all try to do.
Now, when you mentioned weight gain, I was reading about this online, and it was hard for me to decipher online whether that was a symptom or a cause.
So that's a great question, because what came first,
Right.
the chicken or the egg? Did the weight gain come first and that's contributed to the hormone imbalance? Or did the hormone imbalance come first and that's contributed to the weight gain? I don't really think we know the answer to that question. But one of the treatments of this particular disorder is to change the way women eat. And the biggest thing that women can do is to reduce the quantity of carbohydrates in their diet. So the bread, the rice, the pasta, and even the fruit can contribute to women's weight gain in women who have PCOS.
So, Dr. Alyse, I'm hearing so many different things that we often deal with, weight gain when it comes to irregular periods. How do you really know, I think you asked this earlier, Paige, how do you really know when it's time to seek help from a doctor?
So I think if you have 2 or 3 things on the list, then you ought to think about, maybe I have this.
Okay.
And when we talk about syndromes, it's like a picture, a 20-piece picture. So if you don't lay down all the pieces, you don't see the full puzzle. So a doctor has to be suspicious for it. But if you start to have 2 or 3, 4 or 5 things in the syndrome, then you probably have PCOS.
Good information always with the good tips here. We would be remiss, though, to let you leave here today without mentioning that since the last time you've come, flubanserin has been approved.
That's right.
That is what has been typically called, incorrectly you've pointed out, sort of the female Viagra,
Right.
but we get the idea, right?
Right.
It's called Addyi now
Addyi,
on the shelves. Give us the latest here. It's available October 17th, I believe. Is that right?
That's right. So it will be available for distribution for patients to be able to get a prescription October 17th. Practitioners will be required to be certified in order to prescribe the drug. That was a mandate from the FDA. Women will not be allowed to drink alcohol, or there'll be an alcohol warning if you take flubanserin or Addyi. But I think it's revolutionary. We finally have the first FDA-approved drug for the treatment of the most common sexual dysfunction in women. So we are so excited. And this is going to open the door for probably a whole lot of other treatments, just like Viagra did that for men. We used to tell men that erection functions were in their head until we had Viagra. Now we can tell women that, okay, your low libido is not just in your head. We have a treatment for it.
So you're a big reason why. We said we wouldn't be remiss without mentioning. That's because you're a big reason why. You testified and said, look, this is very important.
Right. I was not going to let that day go down without me standing in front of the FDA saying, we need something for women. So I think I equated that to getting married in my lifetime as one of the most exciting events in my lifetime. And so, yes, I'm very, very excited. We can't wait for the women to actually try it.
All right, Dr. Alyse, thank you so much for joining us. We appreciate
all
that you do.
Thank you.